Well, as you well know, what we want to do is we want to see all children back into school at the very earliest moment.
The Education Secretary under pressure to set a date for the full reopening of England's schools. Some Tory MPs are saying bringing back all pupils into the classroom should follow naturally once the vaccine programme has been rolled out to the most vulnerable.
We can't keep schools locked down and our economy locked down forever on the basis that there may be some infection in the community, that long COVID, or people who refuse to take the vaccine. How are we going to protect them? There comes a point where we've vaccinated the most vulnerable, who account for 90% of deaths from this dreadful pandemic.
In East London today, some strains showing amongst affected families.
We are just counting days when they're going to reopen again, so hopefully they're going to open soon. Because especially the kids, it's not only the education, it's a big change in the behavior of the kids as well.
It's better if they open before next month at least, as soon as possible for mums.
When you're kind of doing, having both parents full-time work, it's sometimes an impossible task.
When I'm at home and doing homework, I don't learn because I forget.
You've got to keep it under lock and key, have you?
Absolutely.
Right.
Like any medicine.
Yeah.
The Prime Minister was visiting a vaccine centre in West London.
You get 11 doses out of it.
We do.
Asked repeatedly if he could give any promise of schools reopening before Easter, he said fully reopening schools was a priority, but there could be no timetable for that now.
Some of your own MPs are accusing you and the government of forgetting about schools. When I ask you whether schools will be open before Easter, you can't answer it. They'll assume that means they won't be open before Easter.
No, you mustn't assume that. If I may say so.
But MPs and parents and teachers want to know a rough plan here, Prime Minister, and they have absolutely no idea when schools are going to reopen. Is that the situation you're in? You just have no idea when they're going to reopen?
Well, we're looking at the data as it comes in. We're looking at the rates of infection. We'll be looking at the potential of relaxing some measures. But don't forget that this country has made huge progress in reducing infection. I don't think people want to see another big surge in infection.
The Prime Minister implying repeatedly this morning that fully opening up schools can trigger surges in infection rates.
And where are we going to send this one in principle?
Some scientists say that's where the data points, though it's not quite clear why.
You think the Prime Minister is probably right to say there could be a surge in infections if we reopen schools, but it's not necessarily because the infections are going round and round inside the schools. It could be because the parents have gone to work or a meeting at the school gate.
Correct, yes. The thing is, we don't know. All that we do know is that when you look at when schools, not just in the UK, but more widely internationally, when schools closed, infection rates, the R values dropped, and when they opened, a week or two later, the R value seemed to increase in countries, and that's something that's been found by, as I said, several different groups.
The government says major relaxations of lockdown will only happen if certain conditions are met. The smooth rollout of the vaccine being one of them. Other factors will include hospitalisation numbers and death rates, still at record levels, suggesting the full reopening of all schools could be many weeks away.
The Children's Commissioner for England, Anne Longfield, joins me now. Anne Longfield, the data in your report on children's mental health, a lot of it went up to the end of March, so largely pre-COVID. How much worse do you think the situation has got now?
Well, we know that the first lockdown had a devastating impact on children's mental health and well-being across all ages. And the second one, and now the third one, in very similar proportions. There's a survey that was produced by the NHS from July this year, which showed a staggering prevalence rate of what they call probable mental health conditions. Now, 1 in 6 children have that probable mental health condition, rising to 1 in 5 for older children and 1 in 4 for older girls and young women. Now, those are staggering rates that we need to pay attention to and which need services of that scale to respond.
I'll come back to the services in a minute, but when you talk about paying attention, the 15-year-old in our report, Blessing, says she feels that she and her generation have been forgotten by the government. Has she got a point?
She certainly has, and that's something that so many young people have talked to me about. Of course, older people were of primary risk in terms of health risks. But younger kids and indeed teenagers have had such a secondary mix of toxic cocktails, and really that has started to show in terms of their self-belief, in terms of their confidence, in terms of their ability to interact. And if you add in the learning loss with that, you can see the damage that is doing to a whole generation of children who now need help to recover from this experience.
But you acknowledge the physical threats to the elderly in particular of this awful disease. Do you sympathise with the government? They had to put that first. The mental health concerns had to come second. There was no two ways about it.
Well, look, I agree with some of that. And the government's got a tough job here in managing those risks. But looking at this stage, I've always said that schools should be the first to open and the last to close, and stand by that. But actually, there's a whole now epidemic of children's mental health that we knew was there before, but is now at new levels. And that's why coming out of the pandemic, really government needs to reassess what it needs to do for children's well-being, and I think be much more ambitious in what it provides.
So how soon, in your view, do schools have to open? Does the physical threat need to subside substantially from where it is now before, for the mental health of children and also their learning, schools open?
Well, I would like them to be open as soon as possible, but I acknowledge now infection rates are too high and the pressure on the NHS is too high too. But rather than waiting for this kind of magic moment when schools are going to magically open up, actually what I'd like government to do is put a plan in place that shows the different factors that need to be taken into account, which I think will give parents and children some confidence and indeed hope that it's coming. And I would really like government to report on this in part of their daily briefings at Number 10. And we're talking about things like having testing in place that actually schools are confident in. Priority for vaccination for teachers that we know is going to be really important. That realm of things is really going to be absolutely essential for that point when schools are ready to reopen.
Well, you're asking for a plan from an education secretary who's toed and froed repeatedly, U-turned repeatedly throughout the crisis. Blessing, in our report, the 15-year-old, said he needs to step up. Would you say he actually needs to step down?
Well, I've learned a long time ago not to get involved in who sits round the cabinet table, and there's been quite a few over my time in this role.
Well, you're leaving in a few weeks, so you might as well speak your mind on him.
Well, I think what government needs to do now is really ensure that children are first and foremost in the plans. We know that government are thinking about the economy. We know that schools are actually part of that thinking too. But really that next stage of thinking, what does this mean for this generation? If we're serious about levelling up, we have to get to the point where we look at what children have lost and what they need to catch up. And obviously, for those kids that are disadvantaged, there's going to be a much greater climb for them to get back to the point where they can start to progress in their lives.
Anne Longfield, thanks very much. And we did bid for the Education Secretary, as we have done repeatedly. We still haven't interviewed him since he took up that job.